Hello, and welcome to this presentation. On this video, we will discuss the causes of inflammation. Inflammation is a complex biological process that is essential for our survival. It is the body's natural response to injury, infection, or other forms of damage. The goal of inflammation is to eliminate the cause of the injury or infection, remove damaged cells and tissues, and promote healing. Inflammation can be acute or chronic. Acute inflammation is a short-term response that lasts a few hours to a few days. It is characterized by redness, swelling, heat, pain, and loss of function. Chronic inflammation, on the other hand, is a long-term response that can last for months or years. It is a silent, smoldering process that can lead to tissue damage and disease. So what causes inflammation in human beings? There are several factors that can trigger inflammation, including: Number 1. Infections. Infections are one of the most common causes of inflammation. When pathogens, such as bacteria or viruses, invade the body, the immune system responds by releasing cytokines and other chemical mediators to fight off the infection. This response can cause inflammation, which is a normal and necessary part of the immune system's response to infection. Number 2. Physical injury. Physical injury is a common cause of inflammation. When tissues are damaged, the immune system responds by releasing chemical mediators to promote healing and repair. Excessive or prolonged inflammation can impair healing and cause tissue damage. Treatment for inflammation caused by physical injury involves rest, ice, compression, and elevation of the affected area, as well as the use of NSAIDs or corticosteroids in severe cases. Physical therapy may also be recommended. Number 3. Chemical irritants. Chemical irritants, such as certain cleaning products and industrial chemicals, can cause inflammation. These chemicals can irritate the skin, eyes, and respiratory system, leading to inflammation and other symptoms. Avoiding exposure to these irritants and using protective gear can help reduce inflammation caused by chemical irritants. Number 4. Allergies. Allergies are another common cause of inflammation. When the immune system overreacts to a harmless substance, such as pollen or pet dander, it can cause an allergic reaction. This response can cause inflammation, leading to symptoms such as itching, redness, swelling, and difficulty breathing. Treatment for inflammation caused by allergies involves avoiding the allergen if possible, taking antihistamines or other medications to reduce symptoms, and in severe cases, using epinephrine to treat anaphylaxis. Number 5. Autoimmune disorders. Autoimmune disorders occur when the immune system mistakenly attacks healthy tissues in the body, causing chronic inflammation. Examples of autoimmune disorders include rheumatoid arthritis, lupus, and multiple sclerosis. In these conditions, the immune system produces antibodies that target and attack healthy tissues, leading to inflammation, pain, and tissue damage. Number 6. Stress. Stress is a lesser-known cause of inflammation. Chronic stress can activate the immune system and cause low-grade inflammation throughout the body. This inflammation has been linked to a variety of health problems, including heart disease, diabetes, and depression. Stress reduction techniques such as exercise, mindfulness, and meditation can help reduce inflammation caused by stress. Number 7. Obesity. Obesity is another cause of chronic inflammation. Fat cells, particularly in the abdominal area, release inflammatory chemicals that can lead to low-grade inflammation throughout the body. This inflammation has been linked to a variety of health problems, including insulin resistance, type 2 diabetes, and heart disease. Losing weight through diet and exercise can help reduce inflammation caused by obesity, as can certain medications such as anti-inflammatory drugs. Number 8. Poor diet. Poor diet is a common cause of chronic inflammation. Diets high in processed foods, refined carbohydrates, and saturated fats can trigger the release of inflammatory chemicals in the body. This can lead to low-grade inflammation, which has been linked to a variety of health problems, including heart disease, diabetes, and cancer. Number 9. Lack of exercise. Chronic inflammation can also result from insufficient activity. Exercise has anti-inflammatory effects on the body, and being sedentary can cause low-grade inflammation. Many health issues, such as cancer, diabetes, and heart disease, have been connected to this inflammation. Inflammation brought on by inactivity can be diminished by routine physical activity. Number 10. Environmental factors. Environmental factors such as pollution, exposure to toxins, and infections can also cause inflammation. Pollutants and toxins can trigger an immune response and cause inflammation, while infections can lead to chronic inflammation if left untreated. Reducing exposure to pollutants and toxins, practicing good hygiene, and treating infections promptly can help reduce inflammation caused by environmental factors. In conclusion, inflammation is a complex biological process that is essential for our survival. It is triggered by a variety of factors, including infections, physical injury, chemical irritants, allergies, autoimmune disorders, stress, obesity, poor diet, lack of exercise, and environmental factors. By understanding the causes of inflammation, we can take steps to prevent it and promote healing in the body. As always, it is important to consult with your healthcare provider if you have concerns about inflammation or any other health issue. On our next video, we will be discussing the topic about top 10 anti-inflammatory foods, so make sure you like this video and subscribe to our channel. Thanks for watching.